some meeting notes afterwards. So I just want to just quickly introduce everyone who's joined, give you guys a little bit of background of why we're here, how this came about, and do really like a 5-minute look at where things are with in terms of open health data and the Swiss Association Open Data CH. And then we have a couple of presenters who would like to share some projects, share some ideas, interesting insights. And those are Philip Ackerman, who's with us here, Mark Silverberg, who's joining us from the United States, who's by remote, and Jan Urto, he's just next to me. He'll be presenting live as well. So I think what we should do is just have a quick introduction round first. Just if everyone can just say their name and maybe like a sentence of background, just what you're doing. Okay. So I'll just pass the laptop around. We'll start with the people in the room. Okay.
So, hi, here. So my name is Jan. Most people call me Shalf. I co-founded Aquarium, which is a bio hackerspace in Renan near Lausanne 1.5 years ago. We are 50 members strong now. Aquarium is an open biology community and space. So we have a biology lab. It's in a larger place that's called University with a C, where we have also a co-working space and a maker space, so a whole workshop fully equipped.
So tell us all about that.
Yeah. I'm also, since last November, a board member with Open Data CH, focusing on us as an association being better at using English as a working language and being better at activating the French-speaking community here in Switzerland.
Thanks.
Hello, my name is Friedemann Burgel. I work as a manager at a Swiss software company called medtech. I have been involved in various open data issues since a long time. So, for example, in the end of the 90s, I was involved in getting access to the Swiss phone book directory data for search.ch and other stuff. So I'm here because I'm interested in open data in general, and health is a new topic to me. I've not been involved there before.
Hi, my name is Max Grossenbacher. I'm actually just the opposite. I'm coming from the health side. I just co-founded a small company called Synopsis, and we are producing a platform where doctors and patients can share their data with each other in an easier way. And I'm actually here because, well, my friend Oleg invited me, and I thought it would be a good way to just get to know a little bit more about the open data movement, and I'm really excited to be here. Thank you.
Thank you.
Hi everybody, my name is Juan Pablo Lovato and I'm a project manager of the project Open Quorum Data Switzerland. I'm on the public administration side, and my job is a little bit to motivate public administration to publish their data. And I'm really interested to know why such health data could be useful. I think it's a pretty interesting sector, and yeah, I'm just really curious to know what the intentions could be, what the possibilities are, and so on. So.
Hi, my name is Philip Ackerman. I'm coming from the Zurich University of Applied Sciences, and I will present a bachelor thesis from 2 students using open data in the health area.
Thank you very much. So, because we don't have a signal, I'll just hold the screen up for you guys. So, Daniel, do you mind saying a quick hello to our participants here at the National Library?
This is Mark. Actually, Daniel said he doesn't have a microphone.
Awesome. Okay. Alrighty, Mark, do you want to say a few words?
Yeah, sure. Hey guys, I'm Mark Silverberg. I'm based in Washington, D.C., across the pond. I'm a health data solutions architect at Socrata. I'll be talking a little bit more about what I do, but basically I work with the equivalent of the NHS for the UK over here in America called Health and Human Services, and helping them open the public health data, not necessarily patient-level data, but sort of aggregate information about cost, quality, and other transparency efforts.
Great. Thanks very much for joining, Mark.
Yes.
And Evelina, do you want to say a couple of words? Just a quick greeting? Or are you just listening in? I think Evelyn is officially on holiday right now, so maybe she's not allowed to talk when she's on holiday. That's fine. Yes,
They have a platform for people who want to publish their or else data.
Exactly. We'll talk about them in a bit. Evelyn, feel free to chime in anytime when you want to join. And Mark, we've heard of from now, and so it's back to us. So thanks everyone for joining. There's quite a few people who signed up to do this call, and it started as an email conversation a couple of months ago between myself, Philip, Juan Pablo, and a couple of other folks from the Open Data Association, where we basically got word that some interesting student projects were being done in the area of open health, and they wanted to reconnect to our community and see who would be interested in collaborating on them, or whether it would stimulate any other kind of non-commercial or commercial or research activities. And this reawakened a topic that we've been which was lying a little bit dormant, even though I don't think activity ever stopped. And this topic is open data and as it is applicable to health. And what started as basically one of these topical hackathons. So I've been running these hackathons together with the Association Open Data CH since 2011, and that was one of the first ones where we kind of switched to the idea of having a focus on a single topic. And in choosing a health topic, one of the clearest kind of things that we felt was that it's a subject everyone can connect to. And health data affects everyone in a very personal way. Of course, you could influence, try to influence politics or finance, or have a say in the way public transport is organized. When it comes to health, there are national political issues, but there's also kind of there's a lot of ideas that people had for projects which were very targeting consumers, targeting ourselves. And I think it's one of those areas where open data can really, we can use it to look critically at our choices in life, basically, and see how the choices of other people and the choices of companies and scientists in other countries can influence our decisions. So it's a very personal subject, and so to this end, I'm going to try to share my screen here for our remote participants, and hopefully you guys can see my screen. This is this was our event in 2012, which we had organized back then, and there was about 200 people who joined us. This was in Geneva and in Zurich at the same time, and we had a bunch of projects generated. It was a really busy weekend, right? And some of these projects, the projects ranged from apps and prototypes to really conceptual work, as you'd expect at these hackathons, to some really interesting, really like technical solutions, browsers for looking at special metadata, and also how this health data, we really looked at it from a wide angle lens. So in running this hackathon, we did not say that this is only something relevant to medicine or to doctors' practices, or it's how data affects people's health in general. That maybe is too broad a definition, right? Because you could argue that almost everything, everything affects lifestyle, everything affects people's health. So, but it did allow us in the context of this kind of public event to get people excited, to get people to work collaboratively in teams and generate a bunch of projects. So among these projects, I have been, I haven't had really enough time yet to really contact every single one of the teams and find out what everyone has been doing. But I do know a couple kind of stories, and one of them is that there's some of these projects were really good ideas. They continue to be good ideas, and even several years later, there's still there would be a good reason to continue them. For example, recently I spoke to the authors of this My Generics project, which was an open pharmaceutical database, which basically lets you find generic drugs for anything. And you know, alternatives to this, I mean, there are commercial services, there are even services from health authorities, but there's still no kind of like complete open access, open data database like what they proposed, and a service you can connect to and build apps off of on that at least that I'm aware of. So these guys are still keen to continue it. And also I should notice that note that there's clearly connections between some of these projects and others topics. So this project, for example, was one of the ones we talked about at the last hack days in Lausanne and in Zurich, which was their open research data hack days. And there, for example, these guys talked about their project and what kind of benefits for researchers there might be from having accurate drug databases. The project's around pollution. Again, it's kind of a tangent to health, right? I mean, pollution does affect your health, but you know, long term and so on. They're still pretty active. They're working on some reports, and they had a chance to work with the Swiss government on some consultations after this project. And this project, Compare Hospitals, was interesting. I mean, it was a team I was on, and then we actually continued working on the project for 6 months after the hackathon. And it was just an idea to, you know, put the data that the Swiss Federal Office provided, which compared the different hospitals, and to put it into the form of an app that people could use. And working through the steps and really understanding the data led to actually us having meetings with the Swiss. With the people who did the study, who collected the data, which really helped us to understand kind of details about it and surface new issues, surface new ideas. But in the last year, this project also did not continue. So that's kind of these. I guess the one that I should really that I cannot neglect to mention is the Swiss healthcare insurance premiums map. This was the project from the hackathon which attracted the media attention, which a lot of people referred back to as being kind of the example of what you can do with open data. And it was basically a map of Switzerland where you can highlight any canton you can compare, also based on your age group and deductible and type of insurance you would have, the costs you would have. And it would also have some interesting statistics, like how many beds there are per 10,000 people and how it compares to the national average. And this project actually continued to be updated every year except for this year. But I think that's because this year's statistics are not yet available. So this is actually one of the handful of projects that we are trying to support as much as possible as an association. It runs under our domain name, and we try to make sure that it stays alive. So that's kind of a quick recap of the hackathon. The thing I wanted to also mention was that basically there's been some other events in Switzerland that were very much on a similar topic, and I'm just going to go through. I've compiled a few links that you guys can look at in the Etherpad. But one of these was this hackathon in Valais, which was at the start of the year. Actually, it ran in parallel to the research hack days we did. And these guys really said, you know, we're gonna do something on you can take open data. We're gonna do something on the health topic, and they spent the weekend. And there's videos and projects results which you can see on the website. One of the interesting things is that they did this hackathon within the framework of an international hackathon series called Hacking Health. There is also now a Zurich meetup group which is planning to do a Zurich hackathon, and we've connected to them, and we hope to support them, and also the guys in Valais with any future events of this type they organized. The thing that I can say about these events is that although I haven't gotten to know these communities very well yet, I've heard really positive results, and the Hacking Health sort of community is actually from Canada. It's a very professionally run event series, and its focus is on startups, innovation, and new business models. And one of these very kind of interesting stories in Switzerland is Priv, which Jan mentioned before. We have someone from Priv listening on our call. And this was a startup that creates data platforms that participate at these hackathons. That is very open source friendly. You can look at a lot of their software code online on GitHub. And I really hope that companies like this will support the open data community by looking for ways to share anonymous data that they're creating together with their customers, and that would hopefully lead to kind of an ecosystem effect where people are finding third and fourth kind of new scenarios for using that data. So that's in Switzerland. There's interesting. I mean, health remains a really big topic in Switzerland. I mean, there's enormous amount of research and science funding that goes into medicine. There's the medical profession is I think the largest in the country among the sort of like highly qualified professions for sure. And at the same time, there's this kind of constant talk about not enough people being, there's always a need for more qualified, more people in all the regions, just like probably everywhere, as well as a really interest in what are new innovative technologies and drugs and mechanisms. So I think to me this is clearly something that open data and the idea that we need to be able to think about models of sharing information and knowledge openly needs to be represented. There's also some legislative changes going on. Max, who introduced himself previously, he brought to my attention this new legislation around the electronic patient file, which has been under development for years and was very recently ratified. And so this creates real tangible incentives for groups to start collaborating, and I think that our association should help facilitate that in some way. And so we're going to hear in a couple of moments from one research group in Switzerland. I've put in a couple of links that you guys can explore, also to groups in Greece, England, around the School of Data, which is a really interesting international organization I'm trying to bring to Switzerland. And there's an interesting open access journal for open health data, which has published its second issue recently, and it's really an emerging field of open health data in particular. And lastly, there's a link to something called an open health map, which I think you guys should all look at. It's an initiative that was started at the Mozilla Fest, and they want to basically keep tabs on all the projects around the world which are in this area. And they've already gathered, I think, 50-some projects that people have talked about, and you can find them all here. So without further ado, I'm going to pass the laptop over to Philip. Who is Philip Ackerman, who's here representing the Swiss higher education groups, and he's from the School of Applied Sciences in Winterthur. And he's going to talk about his health visualization lab at the school and give us a demo of one of his projects. So I'll pull up your slides. I'll just give you the laptop, and then you can share the link. Yeah, I got it. Yep, here it is. Let's see if I can go full screen.
Okay, so I will present bachelor work done by Michael Montana and Dominic Zauner. I coached them together with Kurt Stockinger. He's from the data science lab of the School of Engineering in Zurich, in Winterthur. And so I go on here. The main goal was to take the data that is available in public forum from health areas and create benefit out of it by using visualization technologies so that normal users can find out interesting things within these data streams. The visualization is online available via the link visualcomputinglab.ch/healthswiss, so feel free to try it out. Social media, and ended up then in using open data available from the admin side here. They used the 3.js, the JavaScript library, to generate all these visualizations. Were quite successful and easy to go, so that's definitely a good thing. Besides opendata.admin.ch, they used open data from Europe, the European Union, as well as some live trends from Google and from.
Sorry, it seems that the slides were not actually being shared.
Okay.
Actually, this is Mark. I can see the slides.
Hey, Mark. Sorry, Mark, did you see the start of the slides?
Yeah, I can see them.
You can see them now. Great. Okay, it was working. So it's working again now.
Hi there, this is Andre. Sorry for being late. I can't see the slides either. Sorry.
They should be appearing now, Andre. It looks like they're on everyone's screen. There's a little bit of lag. Showing now. Okay, sorry, Philip. Please.
Okay. No problem.
On Oleg.
Okay.
Oh yes. Thank you.
Okay. So one topic that was interesting is, of course, if you have a lot of data, it's not easy for unfamiliar users to get into that topic. So we try to find a good balance between author-driven and reader-driven storytelling. So we try to have a narrative approach to the visualization, starting typically with a guided tour through the data and then ending up in an environment where you can dive into details. Of course, the interesting thing is to correlate different data sets in interesting correlations, which was one of the topics that the students had to do, to find out what is possible, to align the data sets, and then secondly find interesting visualizations to get a good access to all these data streams. There are other technologies used, typically web-based, so that everyone can access all this information. So it's a web approach. Now the question is, how can I live demo? Okay, so again our intro overview, and then you can select different stories here. Some data about hospitals in Switzerland. And then you have here this, okay, can you make this really small again? Because, okay, yeah, okay, great. And then have this carousel to go through all the data. Here you have the interactive visualization, you can click on it, select, highlight elements, get details on specific cantons. So you can interactively browse all these data, going through these elements here that are defined. And if you go to the end of the page, you have an overall view where you can define the range of the time that you're interested, relative, absolute data, so you can really find out the detailed information. There are other topics. Yeah, I think it's best to find out by yourself. No interaction here. Go back. What's going on? There are some European data as well included, so that you can compare countries within Europe with their income rate against we call that in English,
life
expectancies, women and men different, and so on. So quite interesting elements here. Of course, all these health data that give about blood pressure, different diseases and how they develop over time are integrated in that website. So yeah, what we are interested in is how can we go further on with that approach to have better access to all the data that is available. Can we collaborate with government, with other parties that are interested in developing stuff? Can we bring in that source code to the community that we can go on? So that's our interest in discussing how to follow up within the project.
One question I'd have is there a place to see all the data sources just listed somewhere?
On the website, I think if you go somewhere strange here, you can go down and then the sources are linked on each, on the first page. Yeah.
Okay, great, that's perfect. So underneath every visualization, there's linked to the source data. And most of the data seems to be coming from the pilot Swiss Open Government Data Portal.
Yes.
Did you have any issues using it? Getting it?
Well, so let's say this way: the quality of the metadata was not so convincing. So there was a lot of interpretation needed. What's in there?
People that office get some kind of reflection?
No. The students also tried to get data from insurance companies, but that was not possible.
Insurance companies?
Yes, because that would be of interest as well.
Right.
Yeah.
So they wrote letters to the companies?
Yes, and emails and did some phone calls. But,
some listening to the
okay. Yeah. Okay.
So I think this is really interesting. I mean, you can see a little bit that here even in your live demo because the Bezeichnungen in the descriptions. Yeah. I mean, even if you know German, it can be hard to understand what these things really refer to. And I think the same data set that we use to create our, right, I mean, for this particular visualization anyway, we used to create our Android app, we ran into this problem over and over again. So without health expertise or having a contact person, you're just not going to understand what this data means in some cases. And that's not going to help you to explain it to anybody else.
Exactly.
But I think this process you're going through is extremely interesting, extremely relevant. And I would just like to open up to, hold on, I'll just put you back on video. I'd like to open it up to any other questions also from our international participants.
Yeah, I have a question. I was curious. I saw that you used a lot of the data from opendata.admin.ch. Were you guys downloading the data and then basically hosting it and using APIs with D3.js, or were you guys connecting directly via an API through CCAN or whatever so when the government updates their data, that your visualizations will automatically update as well?
Okay, so the data from admin.ch, it was downloaded and there was a lot of preparation going on to convert it into a readable JSON format. There are some live links, especially to Google and also to data coming from a web API about flu in Switzerland, so it's weekly updated. So this is a live link to that data.
Okay, cool.
Okay, and Andre, I know you and Philip, had the kind of email thread that, to a large part, led to this meeting. Did you want to just maybe introduce yourself quickly because we missed you in the introduction round? Maybe just take a look.
Yeah. Is it necessary to? I don't have a camera available. Is it necessary to introduce myself? I'm Andre, president of OpenData.ch, and I assisted as an expert this bachelor thesis, and yeah, we Philip and I, we know each other from, I don't know, last century. Quite right.
Yeah.
From the early stage of our computer science activities. Okay. Oleg.
Great, thanks, Andrew. No, I just was wondering if you do you think that's is this a surprising phenomenon when people are using open data and then coming to the association, to open knowledge, to spread the word, or is this regularly happening in other fields?
No, it was by coincidence when we met in Winterthur for a presentation of this work. I had the idea to communicate about this work and make it known in the community. So maybe no, until now it's not usually, and I think we have several academic work on open data until today, but not too much, I would say. And from the point of view of OpenData.ch, I would be interested to have more information about this works, about these activities, and spread it for the community. And in that case, from my point of view, this work is some kind of a pilot or pioneer to do that.
All right, thank you. Does anybody else have questions to Philip? Go for it, yeah.
Is there any plan to have your work translated into English?
No, there's no follow-up planned at the moment.
Is the Swiss particular work available in other languages than German?
No.
Well, the data sets are translated.
Yeah,
Yes, the data set is in English, but not the web front end.
Okay. Yeah. That could be a cool thing to build upon it.
Exactly. Yeah, there are a lot of ideas how to go on and add features, of course. We could do that with other student works, or we could do it on a more professional way with some finance.
Is it an ended project or still going on with some of the students?
Sorry?
Is it a terminated project?
Yeah, it's finished. It's finished. Yeah.
And what else have you done to promote the project besides reaching out to our association?
Nothing else. Yeah. Also, we did. It's accessible with that link, and that's it. Yeah. So because it gives another good feeling if you have some kind of software that is not maintained. Make a big issue about it. So if we would know that we can develop more features and maintain that stuff, it would be, of course, a good idea to promote these kinds of open web access to health data. Yeah. So we try to find out in which environment could that be possible on a supported level, and how can we contribute to that. Yeah, great.
Thanks very much. I hope you guys have lots more projects like this in the pipeline, and we'll help you get the word out.
Yeah,
sure.
Okay. Thank
you, Philippe. So just in the interest of time, I'd like us to move over to the US, to the East Coast, where we have Mark on the line. And are you able to share your screen, Mark, to show you some slides or something? Perfect.
Yeah, I have a screen. Can you guys see it?
So I'll just turn this around so everyone in the room can watch as well.
Okay, cool. Well, should I go ahead?
Go for it. Yes.
Okay, cool. So, hey everyone. Sorry, I'm on mobile, so I don't have my camera. But anyway, So my name is Mark Silverberg. I'm here in the U.S. and I started with open health data as sort of a data geek. I don't have a clinical background or health background, but I actually started a company with a nurse informaticist a few years ago using health data from the government. And I've since actually sort of transitioned from being on the more of the data consumer side to working at Socrata to help data publishers publish their open data. So working with people from different cities here mostly here in the U.S., but we've got a growing team in London as well as Asia Pacific. But also my focus is on the federal U.S. government. So the nationwide healthcare for the elderly as well as low socioeconomic folks here in the U.S. Those are the main people that I help publish their data in reusable ways. And so I'm just going to take you through a few links real quick, and I want to be super conscious of everyone's time, but just show some of the things that people are doing at both the local, as in city level here, but also the state and federal level, and also show a few open source projects that people have gone and taken this data that the governments are publishing here in the US and then taken it both for open source projects but also to make actual profitable businesses off of. And I know that was something, sounds like there's a lot of cool academic uses over where you guys are, but I think there's, for this sort of movement to be sustainable, I think we might all agree that there needs to be some businesses that actually make money off of this so that they can contribute back and continue this cycle. There's only so much free time we all have on the weekends to do things that we're passionate about. So this is a website from San Diego, a city in California, and they are publishing data about life expectancy, quality of health, and other things. And one thing that's really important that they do really well, I think, is that they don't just give the data, such as 81.6 years is the current life expectancy. They have done a lot of work to add context to this data. So they have this thing where they show data in line graphs and charts and comparisons of their county versus their city versus the United States as a whole, and they should probably be doing it for the whole country as a whole, but here in the US we sometimes tend to forget about other people, unfortunately. And so they add context, and so they add words and pictures and other things to explain what what life expectancy is. Obviously, we all know that life expectancy is how long someone is expected to live, but for different medical terms or hospital terms and things, people don't always know. And so I think it's really important, and this is a great example of what they've done to show, to sort of bridge the gap of the data and of the knowledge. And I'm just going to show a few other things. Here's data.medicare.gov, which, as I mentioned earlier, is kind of the an equivalent of the NHS in the UK. And so I work with them to publish hospital data so that people can come to this website and start to compare hospitals. And so this is their representation. Let me go get to a good page. This is their representation of the data. But what is important is that we have helped them get APIs and dataset downloads and access in Excel and CSV and JSON and XML, all these different formats that open data hackers and data geeks like those of us on this call can go and take into other visualization suites such as D3.js, such as other systems. And so here is this is something called Chicago Health Atlas, obviously coming out of Chicago, and what this is literally this is an open source project that you can actually go and find at chicagohealthatlas.org. And so this is a project that people went and took data off of Chicago's open data portal and built this for the city basically for free. And so the city wanted to do something like this, but enterprising and enthusiastic individuals like us went in and created this. And so it's quite quite complete, if you will, of different types of data that the city has put up in big spreadsheets, but of course they need to be visualized and context needs to be added. And so that's what this group in Chicago did, really interestingly. One big thing that we're seeing a lot of data being published about in the US is about food inspection data. And so this is a data set representation of food inspection, results of food inspections in Chicago. And so what the city of Chicago has allowed people to do is come and see the trend of inspections, as well as filter and look at different community areas. So just as an example, if I wanted to just see inspections that had that resulted in a high risk, I can click and filter, and then we can start to see the trend here. And then we can, all these different cards, if you will, instead of columns in a data set, we have cards, and so people can come and click and interactively filter, find maybe the restaurants that they do want to be eating at, or maybe the restaurants that they don't want to be eating at. And something that I just want to really stress that's really important to everything that I do and all the data publishers that I work with is that this data isn't just in the government's representation. This is all API enabled. You can use JSON, you can use XML, you can use RSS or CSV, etc. And so like the Chicago Health Atlas example, we see a lot of folks coming and taking this data and say, well, the government represents it in the way that they need to, and they, you know, a lot of times they can't do the interesting analysis, and so it's up to the community, such as opendata.ch and the equivalents here in the US, to take this data and really show and create infographics, create D3 high charts, other visualizations to make make the public aware of maybe health dangers or health situations that they need to know about. Two more things I just want to share, and all these links should be in the notes, and I'm happy to talk one-on-one more. But this is a website. As you guys probably have heard, health insurance in the U.S. is a bit of a mess, and so now we have this government-run health exchange, and so this is an example, benefinder.com, of data that the federal level of Health and Human Services, data that they put out, and now this for-profit company is coming, taking that data, of course, for free, and making it easier for people to use that data to come and find health insurance in their area, and then also compare the data and other things. And so this is a for-profit company. This isn't just a hacker on the weekend, and it's not just someone using it for their thesis. Though those use cases are extremely important. This is people using it and committing to continuing to use it and sort of showing a return on investment to the government to sort of pressure them into continuing to publish this data. One last thing I just want to show is something that my company has just started, and it's very alpha, but it's called opendatanetwork.com. And so you can actually come and you can see, you can search across all of the different data portals and data sites of people we work with across the U.S. as well as some work, again, internationally. Latin America is growing very fast, and so you can type in hospitals and get hospital data, not just from the federal government, but also from state and local governments, such as New York, and actually here is Kenya is a big partner of ours, in the state of Connecticut. And so this is very, very early on, but I think it's a good vision of something global that I would like to see, of not just, this is of course just folks working with Socrata, but we're working on bringing in CCAN instances and others, so there's a one-stop shop for people to come and find open data, and hopefully those open data portals will have APIs that are continually updated, and so it lowers the maintenance, if you will, for the projects that we create at hackathons, that if we build them correctly and the government commits to a specific schema, there's not too much work that has to be done when a new 2015, 2016, 2020 data comes out. We don't have to do as much to work on our apps. It just will work because they have committed, and it's all on APIs. So hopefully I didn't go too far over that. I had a few things I wanted to share, but thanks for having me, Oleg, and I was extremely impressed with some of the visualizations that you were able to show, and that the folks before me showed, and I've got a whole bunch of tabs open to start looking at these things and see how they can be adapted, and I can show them to my colleagues here in the US. So just thanks again for the invite.
My pleasure, Mark. It's it's pretty amazing, both the reach of your projects as well as the sophistication of some of the solutions you guys are working on, and it definitely gives us ideas of things we could be doing over here in Europe as well. Does anyone have questions for Mark before we continue?
Yeah, maybe me. Hi, Mark. I had the opportunity to meet earlier this year Brian Sivak, the CTO for the US Department of Health and Human Services.
Yep.
At South by Southwest in Austin, and the panel he was in was really interested. Like, it's the same issue than for the MIT biology is yet another technology, and the discussion was, is health data yet another data set? So I would love to have your opinion on that. Is it something we have to be more cautious with or not?
I think so. Biology data is something that I personally have not worked on too much, and since I'm mostly working with governments and less so with academic institutions and researchers, that's not something I'm seeing open it a lot. I think that whenever we deal with research data, especially data that is at a personal level or maybe an aggregation of people, of course, we have laws here in the U.S. and you all have we all have different types of laws about anonymizing data. I think biology data is some of the most promising data that can be opened. I haven't seen too much of it here in the U.S. One thing that is exciting and interesting, semi-related to that, is clinical trial data. And so there's new law here in the U.S. that all clinical trials have to post their results in machine-readable formats. And so there's a site called clinicaltrials.gov, which will have APIs to allow people to not just enroll and find clinical trials, but also look at some of the results. So that's sort of the extent of biological data that I personally know about, but I know we're trying to work with more and more like genetics and other institutions to make sure that that data gets opened and is API enabled and all this other stuff, so people can, around the world again, can take advantage of it.
Okay. And would you say in that regard that the level of the conversation regarding ethics is sufficient enough? Is it at least existing, this conversation, or not?
I think it's just starting.
Okay.
Yeah. Cool.
Yeah, they're basically the same here, and we're working on that a bit. But.
Well, Jan, why don't you actually tell us what you're working on in more detail? You're up next.
I don't know if it was all last questions. So.
Does anybody else have a question for Mark? I'm sure he'll be happy to get our emails and tweets and so on afterwards as well. There are less, so there's only about 8 minutes left until the hour. This meeting is kind of booked until past. But I think most people will probably feel free to drop off on the hour if you need to go. Like I said, this is being recorded and live streamed, and we'll be publishing it on YouTube along with notes in the next few days. So without further ado, here is over to Jan.
Maybe I can try to do it with my own. Go for it, yeah. Okay. Maybe.
No, this is the participant link. You need to open the other link.
Anyway, so I don't have slides, but the links I will be referring to are onto the pad. So I don't know if all the guys got the link, but anyway. So what we are working on, basically, first thing I would like to give a quick background regarding biohacking in Switzerland. And then I'll explain why. Basically, two things interesting, not only in the regard of data, but in the regard of open knowledge, I'd say more. The first guys are acteria.org. You want to check them out. They have a really, really cool wiki with a lot of science and biology on it. And then we have us, but we are more young. Aquarium.ch, good logo, with a wiki too. And both those communities are working now on things including open data. The project we have on now is Open Food DNA, and we will be working on open data relating to beer and food. with genetics. Why that? It's way easier to start pondering ethics, data, and what that's mean with DNA when you talk about food or beer compared to talking about human DNA. So people can learn how it works, how do you collect, analyze data with DNA, but with less difficulties, I'd say, than the human genome. So we're working on that now. You can find everything online, so I won't be so long. The point is, biohackers are now considering the fact that we should be more active with other classical scientists regarding open data. We are producing and doing stuff on our own, and now in Switzerland we want to work more with regular scientists. I'd say regular because most of the time biohackers define themselves as citizen scientists. Some members of our communities are classically trained in the institutions you guys work on too. But I'd say for Aquarium it's 30 to 40% of our members. All the other ones are retired people who were scientists once, or designers, architects, web developer, citizens basically. People who want to do biology, science, kind of two of them actually we have. But it's still young. Like I said, right now it's easy to work on beer, mycelium, whatever.
It's always been easy to work on beer, trust me.
Yeah. But we're getting there actually, because that's the next step. I'm also involved into the relaunch of Open Data CH in Romandy, so the French-speaking part of Switzerland. We will have our first meetup in Lausanne in August 20. So next
Thursday in a week.
Yeah. And we are planning to do one in October and one in November too. The one in November will have for subject special, it's a special one, biomedical data and ethics. Why? Because right now in Lausanne at the CHUV, so it's the Centre Hospitalier Universitaire Vaudois.
So it's like the cantonal hospital.
Yeah. There is right now a conversation around data, biomedical data, and should that be open or more open. It's around something called the biobank. So basically it's all the research data scientists over there have, and how or should they open them in a way or the other. But the level of the conversation is a huge concern for a lot of people. Being scientists, citizens, ethicists, science historians, and computer scientists, there are some issues to address. So we're opening that conversation to make sure it's going into the best direction for both science and passions.
There was a little bit of a preview to that at the Research Data Hack Day.
Yeah, that was. So yeah, maybe you can say a bit what about that.
Oh, I just want to say that we had an ethics panel at the last event in Lausanne, and there was someone participating from that hospital, and we really touched upon. We actually went into quite depth around ethics. There were some interesting historical examples of data from patients being shared that should not have been shared. So we actually talked about the other extreme. When is data really should not be opened?
The video is online, right?
And the video is online, exactly.
Yep. Get back. The last point, two last points. There is right now an interesting precedent going on with lapayas.org in Paris. They've been a huge inspiration for us because they started doing the same thing as us before us. They just started a collaboration with Roche, the laboratory, around open data for cancer patients. So yeah, they are claiming they will do a data challenge with open data, wiki, and whatever. So you have the website on the pad. Yeah, it will be interesting to observe because it's really a first biohackers and pharmaceutics working together to build a layer of open data, biomed data. So I don't know what it will do, but it's interesting to observe. And the last thing, as I said before with Mark, it's really interesting to see what's happening in the US mainly right now. regarding how the medical sector and the governmental sector are considering data and open data, and the way they treat their customers more than their patients. The medical sector is really going into that direction. So it's about customer experience more than medical, actually. And it has some drawbacks, but it's interesting to see what's happening regarding the service you have to serve your customers. So, and all the different approach for privacy because of that. It's really interesting. So I put some links regarding the panels and stuff there was in Austin on that subject. There are a lot of actors, people you can get the names and follow. There will be again a track, Health and medtech this year, 2016 in Austin. So it's really interesting to see what's happening because the US right now have way more, I'd say, medical or health open data than the EU right now. So yeah, what they are doing with it, it's interesting to see. And that's it.
Excellent. Thank you, Jan. Do we have any questions for Jan?
You talked a lot about privacy, and I mean, this is a huge concern that we have in Switzerland too. It's what data can be given and under what circumstances. I mean, it's hard to even stay anonymous, even if you remove the name and birthday, you still find out who it is. But how far do you think? I mean, would it be really an issue if everyone's data and this health open to a point or not? I mean,
I didn't get the
so the issue is we have to open data. I mean, it's the e-health legislation in Switzerland. I mean, they want to be able to share data. Patients now, patients should be able to share their own data and manage their own data for, let's say, records. And now, I mean, as soon as you give people to share something, we saw what happened with Facebook. They share everything. Like, it's a good thing, but it's also why should
I have 2 points of view on that.
Yeah.
The question is, who needs those data to be open? Who really needs?
Exactly.
Yes, that's the first question. And the second question is, who is funding the work on those data? I guess it's, for me, personal point of view, it starts with those 2 questions. If it's public funded research working on perfectly anonymized data, and the fact that public funded scientists need those data to make science, I'm really okay with that. Yet, all the best science historians and ethicists I know are really, really concerned with that. For 2 main reasons. Right now, the IT people having their hands on those data don't have the technical level they should have, if I say it mildly. And second question, it looks like a race to go the fastest possible without any direction. So it's speed over velocity. Anybody working either in tech or startups or whatever knows that's a bad idea. You need first direction, and then you go the fast as you can. But without direction, it will be a total mess. So again, personal point of view. Second thing, who is funding this research? That's interesting because on a personal level, again, I don't want people working in the insurance sector to be the first to work with those data. Because of what you just said. Anonymization is not the graal. You can infer stuff, and you already do. So yeah, it's an issue for me. So what's the direction? What are the precise scientific needs to solve which problem for who? And then when we have that, we're spending that research. But answering those questions before opening metadata, that won't happen. So basically, we're just doomed to observe what will be and limit the possible problems. But that's a citizen point of view. I'm not a data scientist, I'm not a biologist, I'm not a medical doctor, so yeah. Just personal concern, and with our communities, we are like, okay, it's a complex problem, we don't know what we can do, but at least we're opening a conversation to say, hey, it's not as easy as it seems. It's not just leveraging budget data. I don't know if I answered it.
Yeah.
Do any of our remote participants, Mark, Daniel, do you have questions for Jan?
No, I'm excited to look at all these links that you shared in the doc, and we'll definitely be following up.
Alrighty. In that case, I'd like to open up the floor in a bit for exactly this open discussion that Jan suggests we take as the next step, with a couple of last kind of inspirations. I'm just going to reshare my screen again. So, what can we do? What can we do to open up data right now? Well, we're having this conversation with all of you. We have interesting projects, from research projects to hackathon visualizations. This call originated with the question of what can the association make open data.ch do, right? So we're based in Switzerland, but we're globally connected. We're part of Open Knowledge. We are in conversation almost daily, with our members and with people around the world on these topics. I think that in terms of pioneering work, we have shown time and time again that there's a lot of potential in this community. And so what I would suggest is as a couple of entry points or next steps. If you guys think this topic is important, it needs more support and awareness, and especially work and pushing forward of the frontiers. An easy way to start, I think, is to actually look at the data sources and to pull and put them together in one place. I mean, Mark's exciting company project that he showed it looks really fantastic, useful, and this is exactly what we started doing 3 years ago as well, is just having one place where people can collect all the links and references. I mean, it's not as sexy, it's not as convenient, but you can go through these links, and you at least have here on our wiki a reference to all the Swiss organizations who are responsible for collecting statistics, who are setting up legislation, who are working with insurances, who are working on trials with patients in clinics and hospitals and so on, right? So let's put all the contexts into one place. Let's create some data, some metadata for ourselves to use to keep tabs on what kind of, what is the shape of health data in itself, right? Where are all the actors? What's the landscape like? So that's kind of this ongoing project to document and to keep tabs on what's going on. Of course, we can't look at everything all the time, but it's an open wiki, and we'd really I would really love to have more people helping to contribute this, and everything we do here is going to potentially bubble up to the to sort of the more important national effort to collect data at the government level. So this is this Swiss federal pilot portal which Philippe and his students were using to create their visualizations with. And here there's a Gesundheit category, so health. You can actually click English here at the top, and you can click on health. And you have 120 data sets inside of CCAN which you can download and use. So these two efforts are like there's synergies. I think the more the community is active in using these data sets, being aware of what's going on in the field, and connecting people and actors into one place, the more things will potentially happen at the national level, because we're leading by example. And it's these examples, these little applications and hacks, that actually have a profound effect when people think about new data sources to publish, or these questions that we raise. They come to the forefront of people's minds when they're trying to choose standards, formats, licensing models, and so on for new data. So that's my kind of suggestion, that in Switzerland we have these starting points. We do not have an event scheduled for health data. Actually, next year we have a whole bunch of topics we want to address. We could potentially run another health hackathon. I think the impetus is now in the community. So if there's enough interest there, we could have a hackathon next week. Right? There is nothing stopping us from getting together in a room like this, starting new projects, working with schools, and so on. I have then kind of two other suggestions. So first of all, I am trying to bring the School of Data in Switzerland, as I mentioned. So this is a topic that I've suggested for future workshops. If anybody would like to join us in a data expedition where we sit down for a few days and do what Philip has done with the students, and share tools and learnings and create some kind of report that we really try to push to the next level, something that is a message that communicates a need, a potential possibility that needs to go to the journalists and the politicians and go to the right place. The School of Data is an excellent model that's worked in over 30 countries around the world, and it can work in Switzerland as well. I'd like to also do a quick shout out to Open Trials. We are really excited about this particular effort. There's some announcements a couple of months ago in the Open Knowledge blogs, and this is the idea here is to put together all the scientific information about what drugs and what therapies and what environments and so on. What are all the things that have an impact on your health, and make that data not just available in some academic edition, only usable by other scientists, but actually, championed by the openness community in the same way that, open spending champions access to budgets and financial data around the world, in the same way that that CCAN, the portal, opens up data sets for public use. So Open Trials is a really exciting project. And if you want to take part in this, there is an Open Health Working Group at Open Knowledge, which is starting to spin up. And I'm really happy to help everyone who's interested to join it get involved. We can talk about some ideas of how we can collaborate on an international level and so on. And I guess the thing is that I'd just like to say is that, like, we had doctors come up to us at these hackathons. We had people from health organizations, international health societies, and so on. And what they were basically looking for in terms of our community was kind of a no-nonsense, open-minded, beginner's mind, whatever you want to call it. This kind of approach where, here's the problem, and we're just going to solve it. We're not going to work on the politics and who's responsible and pick argue all day about the right license or negotiate the right process for it. We're just going to do it. And this kind of can-do attitude is, I think, really what we should be bringing to the table. So, the real issue just becomes finding a challenge that motivates you. Whether you think it's this cancer kind of disease or particular condition, like the project from France that Jan suggested, or whether it's kind of the national policy around health, whatever level motivates you. I think this is what everyone here, everyone who's part of this debate, should ask themselves: what would really compel me personally to make a difference in this case? And floor is open. Who else wants to pitch in with a motivating link, an example, a suggestion for next steps? Well, if nobody else speaks up, I'm going to volunteer somebody. I'm going to volunteer Andre again. Sorry, I'm going to just put you on the spot, as you're one of the people who brought us together. Andre, next steps for open health data in Switzerland. What would you suggest?
Is Andre still there?
Hope so. Andre, can we rely on you for last words? Maybe not. Maybe he can't hear us.
Maybe. Well, we are 2, 4, 6 plus
7, 8, 9, 10. Yeah.
Okay, 10 people. What could be next step for us? Next step for me is in November, this meetup in Lausanne, opening the conversation regarding biobank data. Anyway, so I don't know if it's something that could make a good topic for hackathon, but anyway, those data will happen.
So, well, the next step for me is actually I came here to see what it's all about, and we are kind of in the development of software for doctors and patients and the communication between, and it would be nice to be able to integrate this open data that we can find that is shareable within the privacy limits that I just touched on. I I think it would help people to make smarter, not smarter decisions necessarily, but very informed about if they have a condition, about what it actually means, what it has, if it's that bad or not, because I mean, a Google search is always nice, but in forum you get the horror stories, and of course you have every single cancer that you read about as soon as you have 2 symptoms of it, but it would be nice to use real data that we can gather and inform. At least be more aware of the subject. I think it's the first step is awareness, and the next one is then you can do something about it or not. That's your own decision.
Awesome. We need more entrepreneurs engaged for open data, that's for sure. Thank you. Friedemann, do you have any next steps in regards to open health?
For me, actually, I would try to run a hackathon just to get more people involved and also to get a bit more ideas on data and also needs. So to see what the set is that we're working on. I would suggest to go that way.
So if you're interested in a hackathon, I'm actually going to share some links to non-planned in Switzerland, but not far away in Denmark. There's going to be really Denmark or Holland. I'm sorry, I always mix them up. I think it's Holland. In Holland, there's going to in the oldest town in Holland, according to Wikipedia, the source of truth, there is going to be a really exciting 3-day hackathon in a couple of weeks. Also, the NHS, the National Health Service in London, does bi-yearly regular events for hacking health applications, and they're going to do one as well. And you know, even if you can't fly to London or Holland, there's a great chance to participate remotely, try to influence the teams into working on your idea, help along with the project, that kind of thing. And of course, you know, there's at least 2 or 3 groups in Switzerland that are committed to doing health events, the ones in Valais and in Zurich. So with a little bit of encouragement from us, and they have hundreds of members, you know, in their meetup groups. So we should just encourage them to run another event and find out what they need. So I think having another hackathon is a great idea. And click away. Juan Pablo, any next steps?
So my next steps are pretty simple. Like in my project, we have like an expert board of data, let's say producer. I will invite Philip and Schocking to present what they did and try to promote a little bit this project. In particular, I really understand if people of data against of physical health, they need to know about this project. And I'm going to make sure that they do know about this project, and I'm going to use this project also to convince them to publish more data.
Mm-hmm.
Another thing for me is also to understand a little bit more what a producer of this data. Okay, it's one big office, but me is not that clear yet who are the other producer or people gathering something I would like to do, and eventually try to bring these people to publish more data on our open content. What I would like to do.
So I've already reached out to the people who were really encouraging and helpful at the Swiss Federal Office back when we did the project in 2013, and there's been a bit of a reorganization, but the new people are aware of and they will, I think, hopefully be also very supportive. So it sounds really positive. And Philip, next health project?
We can actually be in discussion with you, and of course I go ahead with my students and teach them that open data gives great opportunities to develop great software solutions. So yeah, open data, health data is a good topic, I think, for the future.
Excellent. And I hope that we can help you connect to other people at other universities and Fachhochschule and all the rest, which are interested in this topic, and be a platform for it. Would anyone overseas like to contribute the last statement? Mark? Daniel? Evelyn? Did you guys have any closing words?
For me, it's just this was awesome. It was great to have some sort of exposure and sort of some live airtime with you guys, and definitely I have a ton of, like I said, I have a ton of links open to follow up on. But if anyone has any questions about how we've done this in the U.S. and also how we're trying to do this in London, where I've got some colleagues who couldn't make it today, but also across the EU. I mean, we're always, this is an important topic, and we should be working together. So just more call. I would say it's something like making a show and tell sort of call, whether it's monthly or quarterly, just so it's not all online and it's not all just in a forum. I think getting together and talking about this is very helpful, and being able to do a live Q&A. There's something to, even in this world of like technology, and it's good to get on the phone sometimes and talk about it.
For sure. I mean, in the spirit of international exchange, I'm always very open for that. I suggest that we all just find a platform where we can meet. Like the Open Data Slack channel where you and I got together,
Yep.
as there are thousands of people from around the world interested in all the different topics of openness. But this is a big topic, but it also one that requires focus. And you and I and the others here, we could do a lot to channel the conversation and perhaps create some interesting partnerships for the future. So thank you very much for engaging us so well, Mark, today.
My pleasure. I'm actually going to create a health channel on that open data community. So definitely join if you want, and maybe you guys make a Swiss channel, and we'll see if that works. If not, the opendata.ch, I'm going to monitor this thread and other health-related threads, and definitely see you guys around.
Perfect. So we'll post links to that Slack channel for anyone who hasn't been aware of it yet. And Evelina, I guess you're still on holiday, but receiving our airwaves. We're going to hopefully meet in the next 2 weeks, and I'll try to get you and other Swiss kind of entrepreneurs, marketing people who are really, in the trenches of health, so to speak, connected with us. So Andre, he did tell me that he was able to hear us, but he's not speaking. Ah, look at the chat. I missed a bunch of chats. Daniel says he's a lawyer currently doing research about human rights and life. And Evelina says, thanks for introducing Priv. I think I have an issue with the microphone. And Mark says, can you turn me in?
Okay, microphone issues.
So microphone issues. Okay, it looks like Google Hangout it was not the best option for everybody. I do apologize for any problems you guys had with your setup. So this chat is perfect, and we have a place to continue it, and that is the forum that we've set up. Basically, my next steps is to create publish the video recording first of all, but also put together some notes, which are the basis of which is the Etherpad, and we'll publish a blog post about this somewhere and try to get it promoted. So I think if anybody wants to add some more links or statements or provocative tweets or visualizations, we'll try to get the message out that, hey, open health, this is an important topic. We all came together and we learned from each other, and so we'll try to gather on that in. So we'll make sure to include all the profiles and things, facts that you guys wanted to share, Evelina and Daniel, despite your microphone problems. So once again, apologize for the technical issue there. Okay, so there are no more last questions. I will stop the recording. Okay, great. Thanks everybody so much for joining today. It's been a real pleasure to get to know all of you. Just one big wave from the National Archives in Bern, Switzerland. All right. Good building. Thank you very much to Juan Pablo for letting us meet here today. That's very kind of you. Perfect. All right. Bye. Bye-bye.